All right, so hello everyone. Thank you for joining us tonight for Everything to Know About Alpha-Gal Syndrome. My name is Brianna Thorne. I'm one of the adult programming librarians at the Leonardtown Library. This program is being hosted by the St. Mary's County Library, but we are partnering with the Maryland Department of Health, the Grove Family Health Clinic, and the St. Mary's County Health Department. We also may have some folks hopping in from the Calvert and Charles County Health Departments who may have some insights for us later on during the Q&A portion. So thank you to all of you who are here. I'd also specifically like to thank all of the nurses joining us, as this week is National Nurses Week. So you guys do so much for our community, and I'm so thankful to have you all here with us for this program. So our speakers this evening will be Dr. David Crum from the Maryland Department of Health and Sheri Dean from the Grove Family Health Clinic that is located here in Leonardtown. Our Q&A portion, as I said, will feature some folks from the St. Mary's County Health Department. We'll be having most likely Dr. Stephanie Harper, the Deputy Health Officer. Also have Lisa Nelson, who is the RN Director of Nursing and Clinical Services, and Katie Tippett, the RN Infectious Disease Program Supervisor. We also have a couple of the RN Infectious Disease Community Health Nurses who might be joining us, including Lisa Early, Stephanie Engel, and Dominique Tilley. So without further ado, we can go ahead and get started with Dr. David Crum. So Dr. Crum serves as the State Public Health Veterinarian and the Chief of the Center for Zoonotic and Vector-Borne Diseases at the Maryland Department of Health. Dr. Crum has worked at the Maryland Department of Health since 2017 and brings a diverse veterinary background, including clinical and public health-related veterinary experience to his work. His interests include tick and mosquito-borne diseases and the promotion of the One Health concept, highlighting the relationship between human and animal health. So, Dr. Crum, it is all yours.
Ah, fantastic. So let's see here. Let's see if we can make technology agree. We will share my screen. So thank you very much for having me today. The point is, really we wanted to discuss alpha-gal syndrome, but I wanted to take this opportunity to, talk a little bit about tick-borne disease prevention, let you know a lot of the activities or things that we're doing at the Maryland Department of Health, and then, at the local health department level for tick-borne disease prevention, and really trying to provide a forum for discussion, answer any questions you may have. So this is kind of a two-part forum in which I'll kind of kick things off and talk a little bit about, kind of the background and kind of set the stage, and then transfer it over to our clinical partners to talk about the diagnosis, testing, and, really kind of try to round out the behaviors there. So as it was mentioned before, I am the State Public Health Veterinarian. I do work, again, we love our titles, our long kind of things. I work at the Center for Zoonotic and Vector-Borne Diseases, really, which focuses on any animals that go between any diseases that go between animals and humans. Again, tick-borne disease is a great example of that, and really just trying to focus through there. So one of the first questions that I get a lot is, well, what is a state public health veterinarian? Why is there a veterinarian at the Department of Health? That should be physicians that focuses on human health. Again, we are fortunate here in Maryland to have a state public health veterinarian and also a state veterinarian. Again, that's Dr. Jennifer Trout at Maryland Department of Agriculture. And again, I'm responsible more for the diseases that have, humans, that involve animals in its cycle. I'm not going to be really focusing on the animal health side. That's where my partners at Maryland Department of Agriculture, our state wildlife veterinarian, again, at the Department of Natural Resources, they get to focus on the animal side, but I really get to tie things together and really kind of try to complement something try to complement the response in One Health. And again, the center that I work at, again, the fancy title is we really try to reduce the incidence and impact primarily of rabies is the main focus of my job, but any of the diseases that have animals within the life cycle, that being zoonotic, which means basically from humans to animal or animals to humans, and vector-borne disease, meaning, tick-borne disease or insects, something that's carried through a vector. And again, tick-borne disease and alpha-gal and other tick-borne associated issues are really a prime example of that. So really, what are we here for? What are we really trying to talk about? Really enough about me. I want to focus on what we can do, or what Maryland Department of Health and again the local health partners are doing to make people aware of issues, make people aware of how they can prevent tick-borne disease and where you can find that. And then, as I stated, kind of alluded to, really kind of focusing on alpha-gal and providing that alpha-gal kind of 101. What is the background, touching a little bit on clinical signs, and then really trying to touch on where it is in Maryland. There are some interesting or kind of unique things about the syndrome, not only about the syndrome itself, but some of the data and some of the surveillance about it is a little unique as well. So kind of starting off, as you may or may not be aware, but May is Tick-Borne Disease Awareness Month in Maryland. So as that warmer weather, and spring really starts to come in, well, that unfortunately brings an increased risk of tick-borne disease transmission. And one of the things that we really want to do is, again, not trying to scare people. We want people to go out and enjoy Maryland's tremendous natural beauty, but we want everybody to do it in a safe manner. So there's some very simple steps that people can do. Again, just really trying to raise awareness and really provide those simple kind of prevention strategies to help prevent tick-borne disease. So just keep in mind, again, May is where we really focus on it. But here in Maryland, ticks are active pretty much year round. They're much more active with the warmer weather. But again, May is just a great time for us really to kind of focus on it. We do a very big kind of social media blitz. We do a lot of messaging through our communications office. Again, we also coordinate with the governor's office. They've actually done that proclamation stating that May of 2025 is Tick-Borne Disease Awareness Month. This is something that, we distributed out, and really just want to try to make as many people aware of what we can do to take these simple steps. But one of the things I really want to stress is enjoy the great outdoors. Just because we're talking about tick-borne disease and really focusing on all the things that you can get, again, Maryland has tremendous natural beauty. We are providing simple and easy and very effective steps and ways to try to prevent tick-borne disease. I don't want to scare people and, people thinking, no, I don't want to go outside. The ticks are out there. I want to get things. No, there's easy things that we can do to protect ourselves. And again, spring is a fantastic time to, shake off the doldrums of winter, really trying to get out and enjoy some of the natural beauty. So, we definitely want to encourage that. So really just want to stress, enjoy the great outdoors. We're going to give you some tips and ways to really kind of protect yourself. And again, take that and kind of leading into that, simple things you can do. You want to use an EPA registered insect repellent, DEET, picaridin, IR3535. It's really kind of a personal choice, but these are highly effective at repelling ticks as well as mosquitoes. Again, we're focusing more on ticks today, but not only using these insect repellents is using clothing or gear that may be treated with permethrin. And if you don't want to use insect repellents directly on your skin, you can either treat clothing yourself with permethrin or again, buy gear that's already pre-treated. And these are really highly effective at really trying to keep ticks at bay. Simple steps too, wearing lighter clothing when you go out. That's going to help identify some of these ticks if they are on your clothing much more easily. And again, wearing long pants or sleeves to help keep ticks off of your body as you're walking through the trails or enjoying the great outdoors. Again, if they're on the pants or the sleeves, you'll be able to identify them and remove them a lot faster and then not allow them to attach and bite you. So other things, as you're out there, just really stick to the path when you're hiking. Try to avoid tick-borne areas or areas where ticks may kind of live or tick habitat. Brushy areas, tall grass, those are the places where ticks are more likely to be present. And then afterwards, after you get a chance to get outside, enjoy it when you come home, the recommendation is to shower as soon as possible. Really trying to wash away any unattached ticks. Any of the clothing that you have, you can throw it in the dryer for 10 minutes on high. That's going to dry out any ticks that may be hidden in the clothing. It's a very simple, kind of an effective step. And then this is the one step that I always go is that tick check. I have two children. Every time they run outside, they always come back and say, all right, Dad, let's do the tick check. You want to make sure that you're not having any anybody kind of jumping on board as you were outside. And remember, not only conducting a tick check for yourself, but again, as a veterinarian, I always want to kind of say is, don't forget to check your pets for ticks as well. They can be a conduit to bring the ticks into the house. They are also susceptible to a lot of the tick-borne diseases as well. So, really making sure that we do that comprehensive kind of approach where, we're trying to take the steps to protect ourselves, and again, also protecting our furry friends as well, because again, that also kind of helps in the end that we're not going to be exposed to potentially any ticks also. So just, those are some simple things. And before I got into the, the alpha-gal, or the main thrust of the conversation, just really wanted to let you know that yes, we are making a big focus to help, make people aware of tick-borne disease. And again, when you make someone aware of the problem, you want to provide those solutions or ways to address it. So you may be asking, where can I find more information? Again, our Maryland Department of Health website, as you can see here, if you click on that, that really is focused on tick-borne disease prevention. Again, I encourage you to go, kind of check the website out. There's a lot of great information, not only for the general public, but also for clinicians, public health professionals. Again, any type of individual who may be interested in some of the more in-depth information too. There's a lot of links to continuing education. There's a lot of links to CDC. There's basically just a wealth of information there. So again, that was really kind of the premise of really kind of starting. And again, when I was invited to come down and, talk to you guys, you really just trying to go through and talk about alpha-gal, I really thought this was a great opportunity to, again, alpha-gal is just one of the issues associated with tick-borne. Again, we worry about Lyme disease, which unfortunately is the most prevalent, tick-borne disease here in Maryland. But we also worry about other issues, like Ehrlichia, some of the emerging tick-borne diseases as well. So really just trying to keep that on your radar. And again, if I present an issue or problem, we want to provide those resources where you can provide solutions for it. So now let's kind of get into the main thrust of where we're here is let's talk about alpha-gal. And again, I always want to start, before I get into the particulars, there is kind of a scenario. And you may have someone that or a good friend, family member that has been affected by alpha-gal. But one of the scenarios is that you're out at dinner with friends. It's a typical night. You're enjoying yourself and you decide, well, hey, I want to get a steak. I want to be able to kind of enjoy that. You order the steak. Everything goes great. Again, dinner is fantastic. You're able to come home. Maybe 4 or 6 hours later in the middle of the night, you wake up and things aren't so good. You're starting to have some nausea, maybe some gastrointestinal distress. You kind of feel off, and then you start to notice that you have a large rash that has started pretty much to kind of propagate all over your body, maybe starting on your abdomen or your back. But again, it's something that definitely is not expected after just a simple dinner with friends. And unfortunately, it kind of progresses to a more severe or maybe an anaphylactic reaction in which you need to seek, care. You need to be able to, unfortunately have this addressed. And the evening ends up with a visit to the emergency room. And again, this is unfortunately not an uncommon thing. And again, as alpha-gal or as the syndrome is becoming more either widespread or more understood or maybe even more tested for, this is something that, again, I think, kind of the scenario resonates with a lot of individuals. And, here's just some of the headlines and things associated with it. The mystery meat allergy affects hundreds of thousands, according to the CDC. And then, there may be issues. So, this is something that, again, I think a lot of the people that are on this talk or listening to it today probably have a close association with it. But it's something that, again, as a public health professional, I think over the last 5 years or so, or even longer, we're starting to see it even more. And it's something that's definitely come to the kind of the forefront with tick-borne disease, because, alpha-gal syndrome is kind of a unique scenario in which it's not an infectious disease. This is something that we have associated with the tick bite, but again, it's a potentially life-threatening allergic condition. So it's an allergic associated condition, basically, or an allergic condition associated with the bite of a tick. There's no pathogen that's transferred, it's mainly named for the molecule in which we have the reaction to. And not to get too technical, but it's a galactose alpha 1,3 galactose, or basically alpha gal. This is that molecule that's in there. And it's kind of interesting. It's found in most mammals, but it is not found in humans. And that's one of the issues that we have is, again, symptoms occur primarily after people eat red meat or exposed to other maybe products that are made from mammals, or other products that have alpha gal, or actually this molecule in it. So again, it's known as red meat allergy or tick bite meat allergy. It kind of goes by a lot of different names. But again, it is associated with an allergic reaction to that molecule. And that's what merely kind of makes it unique. And you may be asking, well, what are some of the risk factors? It's an allergic condition. Where do people get it, or how do you become sensitized to that? It's in the United States. It's primarily associated with the bite of a Lone Star tick. And I'll talk a little bit more about Lone Star ticks in a little bit. But again, it's associated with the bite of a tick. Now, most of the reported cases in the United States, we're going to see in the South, in the East, and in central United States. And again, this correlates with where, or the geographic regions where the Lone Star tick is most commonly found. Now, all age groups can develop it, but most cases have been reported in adults. So just a little background there. And as I stated, talking about the Lone Star tick, you can see on the left-hand side, this is a picture of a female Lone Star tick. And the reason why they're named is they have that white little kind of area on their back, which makes them really easy to identify. The problem with this tick is they're extremely aggressive. Most of the ticks will actually sit and wait for someone to come by. It's called questing, where they stick their arms out and try to grab on the clothing. Lone Star ticks will actually actively seek out people. They'll actively seek out hosts, and that's what makes them really such an issue. Also, too, their bite is extremely painful. They have very large mouth pieces. And again, you can just have a kind of a reaction, not just necessarily alpha gal, but to the bite itself. And again, a lot of people report a very painful bite, or just a very irritated, inflamed bite just from the tick, where we're not seeing any pathogens, any bacteria or anything kind of transmitted. It's just the nature of that. And you can see on the right-hand side, this is primarily where Lone Star ticks can be found. And you can see Maryland, we're pretty much smack dab in the middle of it. It's pretty much most of the eastern seaboard, most of the southern coast, any place really where it's warm and kind of on that coastal plain is where that Lone Star tick is primarily found. And again, I do a lot of tick surveillance. I do actually go out and do tick drags. And Lone Star ticks, if I do it anywhere, again, along the Chesapeake Bay or along the kind of any river valleys or things like that, this is the predominant tick that I find. So now, again, this is just a little, if people are interested, I said this condition is associated with the bite of a bite of a tick. This is something that really has, there's been a lot of, not controversy, but a lot of discussion about how does it really go? Is it just a tick bite? Is there another risk factor for alpha gal associated with an allergic reaction? And for those who are really interested in it, this is a paper that was published by CDC, which really kind of elucidates, or really kind of identifies, kind of definitively, that tick bites are a risk factor for it. A lot of individuals that have alpha gal have developed a sensitivity and test positively through it. They all do report a tick bite, or it's one of the more common things. So just a little background there and a little more information. If you'd like to look it further, I do have a link at the bottom of the slide. Check it out. And it really provides a lot of in-depth information that's kind of beyond the scope of this talk, but just trying to provide some things there for you. The other thing I wanted to bring up, historically, we used to say it was just the Lone Star tick that was the issue. And again, you can see around March of this year, there was a researcher released some papers that suggest that maybe, our black-legged tick that we see here, or the Western black-legged tick that we don't have here on the East Coast, we have more out on the West Coast, might be associated with it as well. So one of the big take-homes with alpha gal is I think there's still a lot to learn, not just about the reaction and kind of how it kind of propagates and things like that, but is it, just associated with one species of tick, or do we really have to start thinking of kind of others as well? Now, thankfully, the prevention messaging and a lot of the steps that I kind of highlighted at the start of the talk really work for all species. But again, it's just something that I just anticipate probably some additional information coming out in the future, regarding some of these reservoirs or maybe the risk factors associated with it. So that's a little bit of, kind of the background, what exactly it is. It is an allergic condition. Again, the risk factor is primarily associated with the bite of a Lone Star tick, maybe with other species. I think a little bit has to go. But what are the clinical signs? What do we typically see? As I stated, when I started off and provided that scenario, symptoms usually appear anywhere from 2 to 6 hours after eating meat or any dairy products that may contain alpha-gal. As I stated too, it may not just be ingestion. It may be using a product. A lot of products, a lot of medical or medications, some do actually contain alpha-gal. And reactions are going to be different, from person to person. Some are full-blown anaphylaxis. Others are just a mild rash. Maybe sometimes some people don't have really severe reaction. They just feel off. So again, mild to severe, but the ones that we're really concerned about are those ones that can be life-threatening. Because again, anaphylaxis is not something that you think about when you go to dinner and have, a steak meal with your friends. And for those of you that may not be familiar with anaphylaxis, again, that's going to be a life-threatening reaction that involves, multiple organ systems, basically where the body you have swelling of the face and the throat region. They have a hard time breathing, something that's going to necessitate urgent medical care. And again, the other unique thing, which I think we're really starting to learn, is not everybody has a reaction after every alpha-gal exposure. So, there's a lot of work that's being done primarily with a clinician in North Carolina. They're the ones that really kind of not discovered, but really, I think, brought this to light, brought to the attention of the medical as well as the public health community. It's something that, again, varies among people, varies among individuals who may be sensitized as well. So I think there's still a lot to come, regarding the alpha-gal syndrome and so forth. Kind of highlighting a little, again, I don't want to get too technical or anything regarding, the clinical aspect. My job is just to kind of highlight and set the stage. But as I stated, rash, hives, gastrointestinal issues, nausea, vomiting. Again, you can have respiratory things as well. We worry about difficulty breathing. And again, that signs of anaphylaxis, the drop in blood pressure or the swelling of the lips, the throat region, which really make breathing difficult. And those signs that really mandate, urgent medical care is really going to be needed there. So again, this was taken from the CDC website. You can see on the right-hand side, this is just an infographic showing, the diffuse or really widespread presentation of these hives, again, kind of demonstrating that allergic reaction. So let me get a little bit into the data. Everybody's asking, well, that's the clinical presentation. We know where it comes from. We know potentially some of the things. Well, where is it? And one of the things that is a little unique about alpha-gal syndrome is that it is not nationally notifiable in the United States. And what do I mean by that? Well, a nationally notifiable disease is one that is reported to the CDC by all states. And that is basically mandated that if it is nationally notifiable, all states have to track it, meaning that, if there are positive test results, that basically we have to, investigate those, report those back to CDC, which allows for a national surveillance and kind of tracking. And that's the system that we use for what we call reportable or nationally notifiable diseases. At this time, it is not nationally notifiable. This may change. There is an actual or a formal process in which this goes through some national organizations, and there's some voting. And again, it's kind of a process in which all states kind of contribute and make that decision. Do we make it nationally notifiable, or is it on a state-by-state basis? Where we are in Maryland here, it is not a reportable disease in Maryland yet. It is something that we have started to track, but the problem is, since it is not nationally notifiable, it is kind of difficult to get data on it. Since labs are not mandated to provide that data at this time, it's something that it is kind of hard to get kind of a picture. So what I used for this talk is there was a recent publication from CDC, and they actually were able to get data from a company that performs most of the alpha-gal testing here in the United States. Basically, it's testing. So what they did, they were able to get that and really do a study, or basically an analysis that looked at data from that particular laboratory from 2017 to 2022. And thankfully, I was able to talk with CDC, and they were happy to share that with us. So I'm going to highlight some of the data, and this is probably the best data that we have for alpha-gal, but kind of present it from a national perspective, and then also kind of bring it back to Maryland, because that's what's really kind of locally relevant and really kind of the purpose of the talk here. But I did provide a link at the bottom of the slide, which allows for access. This is something that's publicly available. If you're interested in it, please, check it out. It's a well-written article, very well researched. And again, it's something that is probably the best data set that we have, again, until this becomes a nationally notifiable disease. So this is a figure from that paper that they present, and you can see this is the geographic distribution of, again, suspected alpha-gal syndrome cases. Again, we don't have a confirmatory. Again, this is something that, again, what they mean by suspected is they're people that test positive for, or to have a positive test that correlates with disease, but not necessarily maybe showing clinical signs. Again, at this point, I think the limitation of this study was really only lab values. There wasn't any case investigations or further things with it. But what it does show is that you can see that the highlighted cases are pretty much within the central kind of band along the United States, kind of in the Missouri, Kentucky, Virginia, Arkansas, Tennessee kind of region. That's primarily where a lot of these alpha-gal syndrome or suspected cases are found. And again, it's given per million population per year. So again, it has a heat map, which kind of shows some of the things per county. And again, this was something that I wanted to highlight. But the other thing I wanted to highlight is when you put the two slides together, remember where I showed you that geographic distribution of the Lone Star tick, and then you see the distribution of those individuals that test positive or have a reaction, on a test to alpha-gal, they correlate pretty well. So you can see that Lone Star ticks definitely play a role. Again, the question is that the only tick in which we definitely see this? So I wanted to kind of show these side by side because they really kind of highlight, well, yeah, this is why we're seeing these issues, and we're not necessarily seeing it out west just yet because, again, that geographic distribution of that Lone Star tick. So let's bring it back home. Let's talk a little bit about Maryland data and where we are. Now, again, this data is taken from that same study. Again, what CDC was kind enough to do is they actually, from that national study, actually broke down Maryland data for us. I was actually able to get it. So this is the data from that paper, again, for Maryland residents. And what this graph shows is the total persons that have been tested or tested positive kind of by age group. And as I stated kind of before, all age groups are potentially susceptible, but you're going to see it more commonly in older individuals. And one of the thought process is that, individuals, it takes time to become sensitized to that alpha-gal molecule. Again, it's in tick saliva. It's one of the issues when they bite. You need probably maybe one, maybe two, maybe multiple bites to become sensitized to that to have the reaction. As I stated, there's still a lot to be known, but I think the general trend and the general take home from this figure is that we're starting to see, well, number one, again, a lot of people are being tested for it, but again, it's going to increase as you get older. And then you can see that blue kind of trend of the percent positive definitely increases with age as well. So I think that's the big take home from that. The next one is really looking at, again, total persons tested or testing positive by year. We looked at it by age. So as you get older, you're more likely to test positive or have issues with alpha-gal. And again, some of the testing trends that we're seeing is from 2017 to 2021, that really testing definitely has increased as well. And what I want to mention with 2022, we definitely have some reporting lags or reporting issues, but also in 2022, there were other commercial labs that came on board that offered alpha-gal testing. So I think, again, this is just from one lab in particular. So the reason why a lot of it potentially dropped down is, again, I think other labs were potentially testing. I think there were other commercially available kind of options. So I don't want you to think after 2021, everything kind of dropped. I think that's kind of an artifact of using a single lab and the data set that we had. But really, the general trends to really look at is from 2017 to 2021, 2022 is kind of a weird outlier, is that we definitely saw more and more testing. And I think that's because awareness is definitely becoming, kind of increased, not only among the general populace, the general public, but also clinicians. I think they're looking for it more. And then last, this is one of the slides. It's a geographic distribution of individuals who test positive in Maryland. And again, this is for 2017 to 2022. And you can definitely see this is what we call a heat map. So the jurisdictions that are darker blue have a higher number of positive individuals. And you can definitely see in that region, St. Mary's, Calvert, Charles County, we definitely have kind of a nidus or kind of a region in which we definitely have an increased number of alpha-gal IgE positive individuals per million per population. And again, that's one of the reasons why I was very happy to come down and share some of this information, not just with the health departments and the library, but with you guys as well, that letting you know, yes, we are keeping an eye on this. And again, I think what this really does is really kind of reinforces some of the key points and some of the things to kind of go with. So, if you don't get anything from that study or data, I think these are the key points, that the total number of tests that ordered have increased over time. So there's definitely more alpha-gal testing, that's going. Again, the overall testing positivity, or the individuals that test positive, is on par with what we see nationwide, or around the 30%. And as I stated, positivity is going to increase with age. And I think there's definitely a geographic kind of correlate, or kind of a thing with this. The testing occurs throughout the state, but there's a greater proportion of testing occurring around the Chesapeake Bay and the Potomac River. Again, that coastal plain, or that flat area where those Lone Star ticks can be found. I think that's definitely where we're going to see more positive individuals, because there's more increase for exposure. So that is just kind of the highlights of alpha-gal, the basics of the syndrome, what it's associated with, the risk factors, where we see it nationally, where we see it here in Maryland. But I think most importantly is, how can we take that information for prevention? Again, utilizing those simple steps of, utilizing EPA registered repellents if you're going to go outside and enjoy, the great outdoors, wearing long sleeves, wearing those long pants, and then performing those protective behaviors, those tick checks when you do come inside. Because if you do notice a tick bite, or if you unfortunately do have an episode or anything encounter with a tick in which you're bitten, this is going to encourage you to kind of monitor for clinical signs. Alpha-gal is only one of the things that we're definitely worried about. And here is where I'm going to into the clinical side here, and my clinical partner here is really, hopefully, if we have an educated public about tick-borne disease and what to do and how to prevent it, well, if it does occur, then we can follow through and follow up with primary care providers or healthcare providers in the event, to try to talk about what testing is appropriate. Where do we go from here? And I think the next part of the talk here is going to be really focusing on some of the clinical aspects of alpha-gal, diagnosis, some of the testing things, some of the treatment, and then how to live with it here. So Brianna, those are the kind of the ending of my slides. Hopefully you guys kind of enjoyed some of that. I just wanted to make sure that, again, we can transfer it back and make sure that, we can continue the flow here, but talk more about the clinical side, and kind of get away from some of the numbers and the epi, and really kind of get into the meat of how to deal with alpha-gal. So I'll stop there, and thank you for letting me talk.
Awesome. Wonderful. Thank you so much, Dr. Crum. Without further ado, I'll go ahead and introduce Sheri. So our next speaker is Sheri Dean. She is a board certified family nurse practitioner from the Grove Family Health, which is located here in Leonardtown. She has over 20 years of experience in the medical field, having obtained her graduate degree in nursing from the University of Hawaii in Honolulu, which is also where her husband served in the U.S. Air Force. Throughout her career, she has cared for patients from birth to the end of life. She has worked with patients in their homes, hospitals, urgent cares, and clinic settings. Sheri is passionate about providing quality care and dedicated to joint decision making with her patients. With her passion for providing the highest level of care, Sheri founded Grove Family Health as a direct primary care practice to break free from the constraints of insurance companies and big healthcare systems. This allows her to focus on what truly matters to her, spending more time with each patient, making joint decisions, and offering personalized, proactive primary care. So thank you so much for joining us. I'll go ahead and pass things off to you.
Awesome, thank you. So I'm going to cover the diagnosis, treatment, and living with alpha-gal. Okay, so when somebody comes in and we suspect they may have alpha-gal, we want to get a really, excuse me, really good frog in my throat all of a sudden. We want to get a really good history of allergic reactions, mostly if they've eaten meat, beef, pork, venison. I say anything with 4 legs, including symptoms of rash, itching, nausea, vomiting, abdominal cramping, difficulty breathing, and symptoms vary from each individual, so it can be kind of tricky to diagnose. The timing of symptoms usually appear, like Dr. Crum said, within 2 to 6 hours of ingesting the meat product. We also want to know the age of onset when you had your first reaction. There's also some atypical signs of alpha-gal that people don't recognize as frequently, so it's not, may not be something that your provider may not test it for. It's, brain fog, joint pain, fatigue, vertigo, irritable bowel syndrome symptoms, or some of the other signs. We want to know your history of exposure to ticks, including the presence or absence of persistent localized reactions to tick bites. During the physical exam, we do a skin exam, obviously, to see if there's any hives or rashes, especially on their limbs or your face, or trunk. We'd like to do a heart and lung assessment to notice if there's any wheezing or stridor, which is an emergency symptom that's consistent with anaphylaxis. We do an abdominal exam, checking for any tenderness or bloating. A lot of people, that's their biggest complaint, is diarrhea, nausea, and cramping. And we would review the vital signs as well. So then we would look at lab tests. So I'd like to start with, what is an antibody? So antibodies are special proteins made by your immune system to help protect you from things that can make you ill, like viruses, bacteria, and allergens. Think of it like a tiny soldier that recognizes and sticks to the bad guy, the antigen, so your body knows to destroy them. Each antibody is designed to match a specific invader, like a lock and key. So IgE antibodies are involved in allergic reactions. So when you get your lab tests, they want to make sure it's the specific IgE antibodies. The IgE antibodies bind to allergens like alpha-gal, which trigger the histamine release from the immune cells, and thus the reaction. The alpha-gal IgE test, it's to measure, the purpose of it is to measure the level of alpha-gal antibodies in your blood. A positive result doesn't necessarily mean clinical allergy. A clinical allergy is when you exhibit the symptoms of alpha-gal, such as, rash, itching, nausea, vomiting, abdominal cramps. There's also, they can do a skin prick test, even though this isn't very reliable type of testing. And you can do an intradermal testing, which is where they inject either gelatin or meat extracts under your skin to see if you have a reaction there. Some of it's hard because it is a delayed reaction. A combination of delayed reaction after ingesting the meat products and a positive antibody is what gives you a definitive diagnosis. So that's when we know you really have it and are dealing with it. So unfortunately, there's no current medical treatment for alpha-gal. There's treatments for symptom management, such as epinephrine, auto-injector pens for severe anaphylactic reactions. Really important to have an EpiPen if you have an allergy. Antihistamines to treat mild reactions, and corticosteroids sometimes to treat moderate reactions to kind of reduce inflammation. It's really important to get established with an allergist or immunologist, and also important to make sure that all of your healthcare providers are aware of your allergy, especially when they want to start you on new medication, because it can be found in some medications. Non-medical management. The biggest thing is just strict avoidance of mammal meat, and avoidance of products derived from mammals, excuse me, such as gelatin, which is found in some vaccines, capsules, and candies. Dairy products, some patients are also sensitive to dairy products that have alpha-gal, like cheese and milk. Animal-derived ingredients in medications and supplements is something you want to look out for. There's also tallow, lard, and other rendered animal fats. So you want to make sure you always check food labels carefully and consult with a dietitian for hidden sources of alpha-gal, and so you understand what your risks are. There is a newer treatment out. It's called Solomon auricular allergy treatment, the type of acupuncture. And it's when they place a 3-millimeter needle in a spot on your ear, and they cover it with a little Band-Aid. And they leave it for about 3 weeks, and it desensitizes you. You're supposed to avoid during that time eating meat, obviously, but there was a study of 137 patients that received the treatment, and 96% of them reported symptoms were in remission after it. Seems promising, but there definitely needs to be more research done on it for sure. And then living with alpha-gal. Obviously, avoidance of mammal meats can be really hard too, and kind of changes your whole lifestyle. So you have to find the new ways to cook, new ways to do things, just because you have to avoid those red meats. You also want to avoid organ meats and exotic meats as well. As we talked before, there's so many hidden sources of alpha-gal. It's in like marshmallows, gummies, yogurts, and certain medications because of the gelatin. Dairy products, some individuals are sensitive to milk, cheese, butter, cream, animal-derived additives. So you want to look for terms like natural flavors or lard, tallow or glycerin, because they may be animal sourced. Medications and supplements. So some capsules that the medication is in actually, and injectable drugs like vaccines, some actually have are derived from animals. So ingredients. So you always want to talk to your pharmacist or your doctor before starting new medication. You always want to make sure you carry your emergency medicine on you. And even keeping antihistamines like Zyrtec or Benadryl on you is a good idea as well. And inform medical providers. You should wear a medical alert bracelet that says that you have alpha-gal. And you want to tell doctors, dentists, pharmacists all about your condition. If you have surgical procedures, you want to discuss it ahead of time, because the medications they can give you during this procedure and sedation and stuff may have something in it that you could have a reaction to. Always read food labels. Check for meat extracts, broths, animal fats, or ambiguous ingredients. When you eat out, make sure you tell the restaurant staff that you have an allergy, so they're aware and can try and meet your needs there. And prevent tick bites. That's the biggest one. Like you talked about, using tick repellents and wear protective clothing when in grassy or wooded areas, and doing regular tick checks. Reducing the bites may help prevent the worsening of the allergy or further sensitization. So the more you get bit, well, the more likely you're at risk, but it also can make it worse. And one thing I thought was really interesting is that there's other things that can trigger your symptoms. So you might want to know about cofactors like exercise, alcohol use, NSAIDs like ibuprofen and that. And often women menstruating sometimes can make their alpha-gal syndrome worse and have a worse reaction for that. So that's all I have as far as living with it. I can't imagine. I've had several patients with it, and it's just does not seem like it would be a fun thing at all. It seems that's really hard illness to live with.
All right, so we've got quite a few conversations and messages and stuff going on in the chat, so just give me just a moment. And as I said previously, we do have some St. Mary's County Health Department folks here, like Katie Tippett and Lisa Nelson. I believe will be the main two chiming in when they have local resources and stuff to add. But as we've talked about, there's unfortunately not a ton of stuff out there. That being said, our first question comes from Peggy, who says, I've had alpha-gal syndrome for 5 years and have yet to encounter a doctor who's really educated on it. What is being done to fix that in the medical community?
Brianna, I can kind of start with that. I mean, that is one of the issues that, as this started to come to the forefront is how can we make the public, but also, providers aware. So, in the Delmarva region, Maryland, Delaware, and Virginia, again, at least with the Maryland Department of Health, we've been partnered in an alpha-gal work group, working with our public health partners in Virginia, Delaware, as well as here, really trying to work with, again, some of the nationally kind of recognized individuals. I know Scott Cummings' name was mentioned. As I mentioned, that researcher in North Carolina, that's who I was kind of referring to. He's spoken with the group quite a few times. There's been some great presentations, but also some discussions on ways that we can try to, increase clinician awareness. What we've done here in Maryland is we have a continuing education module from CDC. It's actually on our website. It's something that we share. It's free of charge. It's there for clinicians really to help educate. But we also work with the provider. We also work with academic providers like Hopkins, as well as other researchers in the area. We have what's called a Tick Summit every year. It's a kind of a regional symposium in which we bring providers, mainly researchers, together in the tick community to share a lot of research regarding some of the status of alpha-gal. Again, alpha-gal is mentioned, along with Lyme disease and all the other tick-borne, but it does help with collaborations and raise awareness. Our Tick Summit kind of focuses more on the tick aspect, but Hopkins also does have a symposium which focuses more on the clinical aspect. They do discuss alpha-gal topics. They also discuss other tick-borne disease. So I think with alpha-gal, I don't think we can look at it in isolation. I think it's how can we increase tick-borne disease awareness among providers, for all the diseases, and really trying to go. I think alpha-gal is a really great example of that. But Lyme, spotted fever, rickettsiosis, or Ehrlichia, those are some other issues as well that we need to make sure clinicians are aware of. So as I said, the whole point of Tick-Borne Disease Awareness Month is doing exactly that, the outreach and trying to help with the public, but also help with those providers as to look for where those resources are. And again, on our website, a lot of great CE. And again, as the public health profession, we are trying to increase outreach and materials for those providers so you can find it. So those are just some starts. I don't know, Dr. Dean, transfer it over to you. What are your thoughts?
I think you really have to be active in your advocacy for it as well. I think if you suspect you have it, even just providing the provider with the education and knowledge. That's how I first found out about it, was through a patient. I didn't ever, it's not something that they regularly teach in schools, so I think just you making sure you're a good advocate for yourself is really important.
Wonderful. Thank you guys for that answer. So our next question comes from Anne Rose, who says that, Dr. Crum, you mentioned alpha-gal sensitivity may result after several tick bite exposures. She's curious, is there any research about length of tick bite contact time? For some other tick-borne diseases, the CDC suggests that Lyme disease risk is reduced when the tick is removed within 24 hours.
Yeah.
We also had somebody else add in that Dr. Scott Cummins, who you mentioned, says that if the tick is attached long enough to make you itch, that that's generally enough. So do you have any other insight or
Yeah.
anything on that?
No, I mean, if Scott's mentioning that, again, I agree. It's not an agent that's being transferred. So with Lyme disease, that bacteria have to be transferred through the saliva, through the bite, which takes time. It's actually the molecule, that alpha-gal molecule in the saliva, which causes the reaction. So yeah, if they're on long enough to bite and actually transmit or have saliva in the skin, or enough to cause an itch or a reaction, that's really enough. I don't think we really have definitive answers as to how many bites or how long. That paper that I showed you from CDC, which kind of definitively showed that a risk factor is definitely a tick. I think that's as far as we kind of are now, that, the individuals who test positive with the IgE test that was mentioned, I think there's a correlation with that. But again, for how long, how many bites, I think it's really going to be variable, or we just don't know, unfortunately.
Wonderful. Thank you for that. Our next question, which our health department folks might be able to chime in on, do any of you know of any doctors in St. Mary's County who are trained more so to deal with patients with alpha-gal syndrome, since that is something that's not super widely known at the moment? So I'm not sure if that's even a question anybody knows offhand. So
I'll take a stab at this. This is Alicia Nelson. I'm the Director of Clinical Services for the Health Department. I think typically we would think of allergists as primary treaters of this, but also primary care providers, depending on their knowledge and experience with it, could also be very capable. Pass it over to Sheri and see if you know of anybody else in the community. Or
I know Jennifer Schmidt. She's pretty well versed in it. She's a doctor in Leonardtown. She has her own practice. And then I know Dr. Simlot, the allergist, and his office practice, and know quite a bit about it.
wonderful. Thank you guys so much for sharing those names and resources with us. We had a few folks asking more about the acupuncture treatment that you were talking about, the SAAT. We've got Tanya in the chat saying that Dr. Solomon, who developed the treatment, actually practices in Rockville. So that's kind of cool. We do have one person asking, she says, I was diagnosed in October, but I have not had a tick bite in 2 years. I did have chigger bites in the summer of 2024. Could this possibly be a cause or something that may have worsened the AGS?
I mean, again, this is David here. From my standpoint, I don't think we really know. I think, again, it's associated with the tick bite. I don't know if anybody's looked at chiggers in the saliva to see if they have the alpha-gal. One of the things I always worry about is unrecognized tick bites. You may have unfortunately been sensitized without knowing it. If it is other species, if that CIDRAP article I showed about other tick species that may be associated, that black-legged tick, this time of year, they're called seed ticks. They are tiny. They look like a poppy seed. You may unfortunately have had unrecognized bites, and that's what we worry about. So unfortunately, regarding the chigger, I'm not aware of anything. But again, it's the unrecognized tick exposures that may be the cause. Just a thought.
Awesome. Thank you. She also would like to know what, Sheri, especially your thoughts are on with her reactions being so severe, because she has had numerous life-threatening episodes and had to be hospitalized before. Would you recommend that she look into that acupuncture, basically like the SAAT treatment?
I definitely would. I mean, what I've read about it, the studies I've seen about it seems really promising. And unfortunately, there's really no other treatment, just avoidance. And So why not look into it? I know there's a doctor in Waldorf that does it as well.
Wonderful. We do also have somebody in the chat who wanted to share that sometimes mammal byproducts are actually utilized in tampons and toilet paper, which I thought was interesting. So I wanted to share that. So we've got some people who've spoken with acupuncturists who are not practicing this, but it looks like we've already discussed that. Oh, we've got Tanya asking, can either of you share some information about tick-borne illness testing as far as the testing of the ticks? Like if you bring in a test, like a tick saying this one bit me, how does that work? Does that help or?
Yeah, I can definitely address this. This is a question we get a lot, and we basically kind of promote CDC's recommendation to not use tick testing. There's a couple of reasons for it. The first reason is a lot of the commercial labs that may offer it may not have as stringent standards, so you may not get accurate results. You may actually get false negatives or false positives. But also, too, even the fact that the tick was positive does not automatically assume that there was transmission of the pathogen. So for Lyme disease, it takes up to 24 to 36 hours for transmission. And again, it's something that may raise the index of suspicion or may start discussion with your provider, but again, doesn't automatically assume you've been infected. The other thing, if you get a negative, that may give also kind of false sense of security because of the potential for unrecognized tick bites. So really, it's after getting a tick bite or exposure is really having that discussion with your provider, but really monitoring for clinical signs of tick-borne disease. The bullseye rash that not everybody gets, but is very characteristic of Lyme disease, the fever, the flu-like signs, any kind of redness or swelling around the tick bite. Those are the things where you want to talk to your provider or seek medical care to talk about what is the best option. And so again, I understand the impetus of, we should test the tick or how do we try to do it? But based on some of the things that we talked about, it's really the monitoring for clinical signs, the informed decision-making process with your provider, and really going from there.
Wonderful. That was great information to know. I actually did not know that. So we've got Nancy asking, besides heparin and antivenom for snake bites, are there other well-recognized medications that AGS folks should be actively aware of?
So I wish I could remember what website I went to. If you, it's a main alpha-gal website. If you Google alpha-gal, I can't remember the name of it, but if you can look it up and it'll give you lists. I even think the CDC has a list of all the medications and all the products that you need to avoid. I actually have a printout list I can get to you somehow, I guess, if you want. But because it's in lots of stuff.
Yeah, I did Google just now and I did find a couple different websites that look to be slowly putting these lists together. Unfortunately, like we've talked about, it's something that's slowly being studied. We have had a couple people in the chat mention that they've had reactions with the flu shot. So that might be something people might also want to keep in mind. We do have some folks mentioning that seed ticks are often mistaken as chiggers. So like, Dr. Crum said, just kind of be aware, especially with those bites that you may not recognize. We have one question that's, what is the likelihood that we can get it reportable in the state of Maryland, especially if it's seeming unlikely that it's going to be nationally recognized?
A great question. I wouldn't say it's unlikely that it's going to be nationally notifiable or recognized. I think as it becomes more widespread and more known and kind of made aware, I think there is this general transition to that. I mean, there is a case definition that has been developed, but again, the process for making something nationally notifiable does take time. It is something that requires, so I would kind of trust in that process, and I would not be surprised if it does become nationally notifiable. But again, it takes time to get that data, to get the recommendations, to really try to make sure if it's going to be done, it's going to be done correctly, because you want to get that surveillance so you're accurately representing the true rates of disease and really trying to make sure we have the accurate data. So So really, it's kind of trust in that process. It's something that we've talked a lot from the regional perspective, but also when we get together nationally, alpha-gal is a very big topic amongst us. So it's something that we're not just talking about it here in the Mid-Atlantic. Yeah.
That's Nancy has added into the chat. Nancy is actually the person that recommended we do this program, by the way. So thank you, Nancy, for being here. Nancy is recommending that folks reach out to Senator Bailey. Apparently he is doing some stuff with getting it reportable in Maryland. I'm not sure if you can confirm that or not, Dr. Crum. But our next question is, do you guys have any recommendations on red meat alternatives, such as ostrich or emu?
And this is David. Unfortunately, I don't have any recommendations on, I would defer to the allergist and your provider really talking about what would be the safe alternatives. Yeah.
All right. We've got one from Karen who says, after a tick bite, is there any sort of preventative treatment that they should look out for? Are there any antibiotics they could get as preventatives for anything?
And this is David. Oh, go ahead, please, Dr. Dean. Go
ahead. So for Lyme disease, there is, we often treat with doxycycline. There's certain criteria though that we look at. We look at the type of tick, we look at the length that the tick's been on, your body, and even the localized reactions and stuff. And we look for the erythema migrans, which is the bullseye rash. If you have that, we definitely put you on the 2 weeks of antibiotics or 10 days. Other than that, there's really not an antibiotic for alpha-gal or any other that I know of.
All right. And really quick to go back to the red meat alternatives, Bonnie has added in the chat that she thinks emu is very good and the texture is close to beef, which is good to know because I've never had emu. Our next question is, could you, either of you, give more information about the brain fog fatigue issue? Are these seeming to be permanent? Are there any suggestions you have for folks?
So it's actually been a newer thing for me with the diagnosis. I've had a young patient recently who had severe brain fog and fatigue, and we tested her for alpha-gal and it was positive. I don't think that there's a lot of information or data on like how long it will last. I mean, as long as, you're sensitive to the allergy, it's like any other illness in that respect. So do you have anything to say, Dr. Crum, about that?
No, unfortunately, as you said, it's kind of one of those emerging things that's been mentioned kind of anecdotally and kind of going through. So I think as I stated, I think there's still information and a lot to learn about the disease progression and syndrome and really everything that it encompasses. So as the work, I think, with Scott Cummings and everybody down in North Carolina and a lot of the research that he's doing, I think there's a lot of things coming down the pipe that are going to be really interesting.
Wonderful. And just to jump back a little bit to that red meat alternative again, apparently they are working on some alpha-gal safe pig that Joanna says she has never tried, but she has heard about. So that's pretty cool.
Yeah, there was a big article dealing with bacon, alpha-gal free bacon.
Everybody does love bacon. And then with the brain fog, Peggy mentions that her brain fog decreased after correcting some vitamin imbalances that actually came from not eating mammal meat. Does that sound like something either of you would recommend folks look into?
Yeah, definitely. Also, brain fog is such a hard thing to pinpoint where it's coming from and what it is, because it could be hormone imbalances, it could be multiple things, some of the symptoms you have. So I think making sure you get checked out for the basic stuff first is really important too.
Wonderful. Our next question comes again from Ann Rose. She says, One Health is a great opportunity for public health outreach. She recalls a smoking cessation campaign that focused on smoking impact on pets. Are there any campaigns through veterinary clinics and providers about preventing tick-borne illnesses? Pets receiving tick prevention treatment may provide a false sense of security in a lot of households because live ticks can be carried into the household on pet fur.
Oh, and you bring up a good point, and that's the whole reason I mentioned those tick checks on the pet. This One Health, it is, we're in together. So our pet's health definitely is going to impact or really kind of have a significant influence on our health as well. We do a lot of outreach and discussion with veterinary clinics. Now, we do it in conjunction with our partners at Maryland Department of Agriculture and the Veterinary Board. And again, it has included tick-borne disease, because again, Lyme or Ehrlichia, a lot of the tick-borne issues our furry friends can get as well. Thankfully, alpha-gal is not one of them. So no, but there is a lot of collaboration and correlation with that. And again, thank you for bringing up the One Health aspect, because again, it is something that we really do focus on. And I think here in Maryland, a lot of the interplay between our animal health partners and public health is really strong here. And again, tick-borne disease is just one example of that. So yep.
Wonderful. Thank you for that, especially because I know a lot of us here have pets, so it's good to know that they can't get alpha-gal. Our next question actually comes from Peggy, who wants to know, how often do people with AGS generally develop MCAS? So I'm not sure if that's something that's been really looked into much.
I'm not familiar with any studies or anything that can, share anything.
The MCAS is also such a hard diagnosis as well. So I don't know that, personally, I don't know of any, I don't know how often it occurs. I would have to look it up.
All right, so at the moment, oh, here we go. We've got another one. We've got Rebecca, who wants to know, has anyone been prescribed or talked about using, I apologize for my pronunciation of this, Xolair, which was recently approved for food allergies? She said she's been on it since July, and it seems to be helping. So do any of you have any thoughts on that as a possible?
I don't know if the indication specifically for alpha-gal. I've heard of it and know it for other allergies, but I've never seen it used personally in alpha-gal. So I'm not much help there.
Well, and like we've said, is a lot of this is going to be talking to, your allergist, that sort of thing. So, I mean, hey, if they recommend it for food allergies, it's worth a shot. So far we don't have any more questions in the chat. If anybody has any, please feel free to type them in there. We do have a comment from Bonnie, who says this has been very informational. She does not live in Maryland anymore, but visits a lot and found this very, very helpful. Oh, here's another question. Do any of you have recommendations for pesticides that are safe for our waterways? I'm not sure how that's quite, well, that would be prevention of ticks. So I'm not sure if either of you have any thoughts on that.
I think questions related to pesticides. I mean, for mosquito control, there is no tick spraying conducted by the state of Maryland, but reaching out to Maryland Department of Agriculture or the Department of the Environment, they probably have much better recommendations regarding the pesticides. Yeah.
It looks like they're thinking specifically to treat for seed ticks. Do you have any recommendations for preventatives for that, maybe?
I don't have any recommendations, since we don't, again, advocate for spraying, or we don't conduct the spraying. It's those personal protective behaviors that we really kind of try to promulgate out. So unfortunately, I have no recommendations.
Awesome. Thank you so much for that. Has the CDC, to either of your knowledge, considered making a database of alpha-gal safe items? I know we talked a little bit ago about how places are starting to compile lists.
Yeah, there's been a lot of discussion kind of about that. The link that I had on one of my slides did show a lot of products that may have it. The problem is that is a pretty long and extensive list and can be really difficult to compile. But that has been something we've discussed in our Alpha-Gal work group, and CDC is aware of it. I'm not aware of the status, but there were definitely some logistical challenges to that.
Well, that's good to hear that that's slowly looking to become a thing. We've got some folks mentioning that there is a nonprofit pharmacy called Pill Clarity that's researching medications for alpha-gal patients currently. So that might bring us closer to getting a list like that together. We've got some folks basically saying that they're very happy to know that they're not alone in dealing with this. I know we have talked about how the numbers are increasing, especially in St. Mary's County, Calvert County, Charles County. So no one is alone in dealing with this. We're all in this together. Our next question is, has there been or will there be a tick drag in any Southern Maryland counties? Not sure if...
Well, a tick drag, I mean, it's not like just one drag and you're done. If you're asking about tick surveillance, it is something that's difficult. Tick surveillance is very labor intensive. It's also, unfortunately, does require a lot of manpower and funding associated with that. It's something that we are looking to try to expand the infrastructure and trying to get. As of right now, the state is not able to conduct any statewide tick surveillance, but we do actually get out. Again, I have not personally conducted anything within St. Mary's County or down on the Eastern Shore. It's something we're always looking for opportunities to do so. So that's something that we would be open to talking with local jurisdictions or local groups. Again, though, there are some logistical things where it has to be done with certain criteria. It has to be done at certain times of the year. It's not like you can just go out and throw a sheet out in the yard and catch ticks. There's some logistical challenges, but it's something that, again, we are open to it. We're always looking for opportunities to do it and trying to get information, not only for the Lone Star tick, but again, the Asian longhorn tick, that invasive species. There is a lot of work done through our academic institutions too, not necessarily through our state, but a lot of researchers, you may not know, are actually in Maryland doing a lot of tick drags.
So the website that gives a lot of information and even has like links to click on medication places that can tell you which medications are safe is called alphagalinformation.org. So I found that really, yeah. And so I found that really helpful, really useful.
Awesome. That's good to know. It's very easy to remember. So
it is.
If no one has any more questions, again, I want to thank all of you for coming. Thank you to all of our, both of our presenters, all of our wonderful health department folks for hopping on here. And thank you all for joining us for this library program. If you are interested in any of our other programs, please feel free to hop on the library website